Thank you and good afternoon, everyone. I know this is the most challenging time to be presenting. Is after lunch, is before the after lunch nap, and a number of other things. So I know folk are scattered and all over the place, but that's okay. We're going to press on with our presentation for now, and I pray that it will bless you. A couple of disclaimers that I need to start with. First of all, I've asked Grace multiple times, are you sure you want me to do Deliverance? And she has made it absolutely clear to me that she wants me to do this. So I am honored and grateful to Grace. I honestly am for this opportunity to be here. I have learned so much. The presentations have been absolutely excellent. And I'm looking forward to the follow-up of gathering the resources that I've learned from the seminars here and implementing them. So I thank you. It has been a grand experience for me and a great opportunity just to be with you today. So here's where we are. This topic of deliverance matters deeply for me. This is a part of a very long journey in ministry and in life. I didn't know that I was going to end the journey. The process would bring me to deliverance, but this is where I am. This word, this concept wasn't in me until God downloaded it in me and helped me to bring a number of initiatives and Adventist experiences from pastoring, from working in inner city contexts, from talking to Adventists, from teaching. A number of experiences brought this together to where we are today. So it is an ongoing process, and I'm enjoying the journey. One of the good things about being the health ministries director for a conference as a pastor is that the conference has asked me to take the applied theological principles that I've used as a pastor in the congregation and now do it for our entire conference of 173 churches. So the concept is what you have done in the local church, do it for all of our churches in the Allegheny East Conference. So that's why I'm here, and that's what we are doing today. Now, I have some things to share with you, some things you have heard, but it builds the platform to where we are going and why this topic matters to me. There is this critical concept. When asked to put together or to birth and develop a program for the Allegheny East Conference, which is a regional conference, and looking at our historical journey over the years and my value and appreciation for the Adventist health message and my firm belief that the message matters for all people groups and it ought to be relevant for all communities, and to look at the historical irrelevance of it in underserved communities where the majority of our churches are. The critical question always is, if your church disappears, will the community miss it? So in trying to answer that and look at the relevancy of our churches that operate in inner cities, before there were centers of influences, our churches were there as centers of influences without the title centers of influences. So the critical question is to contextualize the Seventh-day Adventist health message for underserved communities. That's what this whole presentation is about, how we do that, what is the process moving forward. We start with this clear thing that we know poverty in America. We know poverty is in America, a significant challenge in our society. Over 40% of the world lives in poverty, that the United States has one of the highest rates of poverty in the developed world. And we look at poverty, as we know, if anyone studies, any sociologists or others, that there is this notion that the burden falls disproportionately on communities of color. We talk about poverty, we always connect underserved communities. When we talk to underserved communities, we're always targeting communities of color. And we know that poverty is all inclusive. It impacts every component of life. It's more than just economic. When there's poverty, you see the manifestation of poverty spill over in so many areas of life and existence in these underserved communities. I can't overemphasize that enough because it is critically important. And when you have these levels of poverty, you also have social determinants of health. that are well studied and looked at, and we look at them, how the results of poverty, underserved communities, and the social determinants of health that impact, you know this, the education, quality, economic stability, social and community context, healthcare access and quality, neighborhood and built environment. So they're interconnected together when we look at the issue of poverty. We also look at social determinants of health, and we also look at health disparities. They are all intertwined together, and they become critically important for where we're going to contextualize the Adventist health message for these underserved communities. And what we know about health disparities is that the top one matters, can last for generations, and generations and generations. It's amazing how that works, and we ought not forget that. It's not a one-time event. Closing the gap requires addressing social determinants of health, perpetuated by discrimination and income inequality, and differs in health linked to social and economic disadvantages. Now, we could stay here all day because a lot of the Adventist nomenclature, when we talk about holistic health, sometimes ignore these concepts in serving underserved communities and looking at those critical issues. So if we talk about wellness, we talk about wholeness, these blocks are necessary to complete the spectrum of wellness and wholeness. In any place where the blocks are not there, are not built, then you have a system that has problems. And we just look at these. I like starting from the bottom up. The spiritual is the foundational, social, environmental, occupational, intellectual, financial, physical, and emotional. And you know that all these components represent wellness, and the absence of any of them represents area that have to be corrected and looked at. When we look at the person, we look at the community, we're looking at the totality of the person. They are not compartmentalized the way we like to do so. The whole person matters. These two quotes must be mentioned in all my presentation, that the union of Christ-like work for the body and Christ-like work for the soul is the true interpretation of the gospel. By profession, I am a pastor, and I told you earlier, I believe in this holistic approach, that the gospel is not either or, is bringing the gospel message and health reform together. Ellen White says it's a true interpretation of the gospel. And she says that the principles of health reform are founded in the Word of God. The gospel of health is to be firmly linked with the ministry of the Word. It is the Lord's design that the restoring influence of health reform shall be a part of the last great effort to proclaim the gospel message. This is the end time message. And the end time message cannot exclude health reform as a part of the end time message. You know, we were talking yesterday about the right arm of the gospel, and I was sitting there, and I promised myself that I was not going to preach grace on this point. But it's interesting about the right arm of the gospel. What is it? We're trying to define that. You know, Scripture gives me a partial answer to what the right arm of the gospel really is. There's a story in the Bible that Jesus healed. In Mark 3, he healed a man with a withered hand. You remember that story. But it's interesting that in Dr. Luke's gospel, Luke 6:6, he identified the hand that was withered as his right hand, indicating that the injury was a career-ending injury. That not only was he injured, he lost his economic ability to provide. He lost his status. He probably lost his position in the church. It impacted him emotionally. It impacted his family relationship. And when he came to church, he was a man in the back of the church. So it's interesting that when Jesus healed him his right hand, when he stretched out and healed his right hand, he restored the man to wholeness. So I want to suggest to you that the right arm of the gospel is the arm that talks about total restoration to wholeness. That's just my interpretation from the Bible on what it really is. So this comes out of this concept here. The holistic health breaks down prejudice. Ellen White further says medical missionary work must have its representatives in our cities. In our cities. Centers must be made and missions established on right lines. Ministers of the gospel are to unite with medical missionary work, which has been presented to me as the work which is to break down the prejudice which exists in our world against truth. We want to combat all the extremism. We can do it through health. If we're clear about holistic health and following the principles to make the difference. So, Dr. John Harvey Kellogg. Now, we heard so much about him today. So some of the presentations, I was sitting there going, they already know what I'm going to talk about. More than a bowl of cereal. So I just want to point to the critical areas that we've already mentioned and highlight just one or two of them. As was mentioned, I think Peter mentioned this earlier, that the Chicago Medical Mission, which started June 25, 1893, free medical dispensary, free baths, free laundry, free obstetrical care for poor and unemployed, penny lunch. He always had these penny lunches. You get a bowl of beans and setback crackers. Any of you remember those crackers? And later on, there was 5 cents for breakfast, that there were 5 items, and you can choose off 5 of them for 5 cents. What is significant about this is that, as was mentioned, he went to Chicago. He asked to go to the worst areas in Chicago. He asked the police department, where are the slums of Chicago? Because that's where I want to set up camp. That's where I want to take the principles from the Battle Creek into the inner city. I know we're doing in Battle Creek, but let's go to where the people are. That's the concept that I want us to forget. And let's not just go to any neighborhood. Let's go to the worst neighborhoods in Chicago. And there, let's give the people what the people need. Because what was clear in that time period, that not only was there homelessness and the lack of resources, but for many people there, that the only clothes they had were the clothes on their back. And because they wore them all the time, 2 things they never did. They never washed their clothes and they never bathed. So to provide this notion of free baths and free laundry was revolutionary. Let's take care of their basic need. And so this is what John Harvey Kellogg saw as what Battle Creek should become, to extend its services beyond where it existed, to go to the inner city and to do something special here. We also know that he established the Working Men's Home in Chicago in 1896. And what is interesting is that this place served no meat or condiments, tobacco, alcoholic beverages, and narcotics were forbidden on the premises. It housed between 300 and 400 men, and had a free kindergarten and nursery, day nursery for working women, a cooking school, classes in sewing and manual labor, health lectures, courses for adults and children. Ahead of his time, doing things that matter in Chicago during this time period. Quite interesting, beyond all the things we already discussed about Kellogg. He had, for me, multiple personalities, because the same man who was doing this was doing other things. And he also had an orphanage. I remind individuals in Tennessee for black children. He took black children and established an orphanage there. Very complex person, but in his earlier years was doing some phenomenal things, setting a model for the Adventist church to follow that we have forgotten about. You see, sometimes we focus on what's wrong with a person, not what's right. And because what's wrong with a person blinds us from the things that we can still learn from them and use them moving forward. So this was an important time period in building a foundation for me, what a medical doctor was willing to do to serve humanity based upon the skills, the gifts, the training, and the resources that he had for him. Ellen White's health visions. You saw those today. I was very interested in that presentation because I'm going to take you here and I'm going to take you someplace. All I'm really doing is setting you up from where I'm going, laying a background for why it matters to contextualize the Adventist health message for underserved communities. And the first thing is, the issue of addressing poverty and the social determinants of health and health inequalities, how we can do that, especially with the Adventist health message. Notice these dates and these visions that God downloaded in Ellen White. In 1848 was her first health vision. We talked about that. She talked about the harmful effects of tobacco, tea, and coffee. 1854, cleanliness and dietary matters. You will see a progression in her health message, and they all didn't come at one time because individuals weren't ready for them at one time. So you see years passing before God gave another health vision, because God knows all of us, humanity, is slow to accept things. And even those who are following God were slow to accept things. And also you will notice that this 1848, we're on the heels of the 1844 Great Disappointment. There are a number of things that the church is going through. So the church really couldn't handle too much information coming about changing health habits. So don't miss those. Are critically important issues. It's the 1863 vision that we focus on the most as this comprehensive health vision that God has given to our church, and it is a critical health vision. We'll circle back to that. The 1865, I call that part 2. It was in this health vision, which was discussed in 1865, where she really began to talk about, after John was at the Danville sanitarium there, it's time for us to really start looking at establishing our own institution. And in 1866, the Western Health Reform Institute was established. That was the first one that we can clearly identify that this is Adventist owned, being developed. You also know that it later became the Battle Creek Sanitarium, this same institute. And it was a learning experience. When God was telling Ellen White and the early church to establish hospitals, we didn't know what we were doing, but it's a learning experience. And that's the beautiful part of what I see, is that I'm willing to try something and fail as opposed to not doing anything at all. Make mistakes, learn from mistakes, and press on. So we see this progression taking place here. And then it was finally in 1871 that this fifth comprehensive health vision that spoke specifically about establishing our own institutions, why we need Adventist hospitals. It was interesting when the last presentations that was presented about the 12 reasons, 12 principles, why we should have Adventist health care. Well, I have one because God said so. This was God-driven. This was God initiative. God said, I want you to establish healthcare institutions. And that, for me, is the premise to why we have what we have today, and I'm grateful for that. So let's go back to the third health vision, the June 6, 1863. Why this is important is because when it comes to our narrative and our messaging about talking about Adventist health, this is normally by far the starting point. So in all of our communities, well, where did this health message come from? We talk about Ellen White, and then we rightly talk about this comprehensive health vision that God gave her on June 6, 1863, something that is well known. And then we take time, if you want to take time, to look at, well, what were some of the guiding principles? What was God saying to the early church? And why was he saying it to the early church? Well, I'll answer that question because many of you already know that the early Christians were dying as rapidly as other people. So God was given this comprehensive health message to start building longevity in Adventism. But the message had some stark and very clear principles, things to live by. Those who do not control their appetite are guilty, in eating are guilty of intemperance. That was a loaded statement then. And swine flesh is not to be eaten under any circumstances. And there was tension by early Adventists to push the issue, tell people to get off pork. But Ellen White was saying, not yet. Folk are not ready for that. It wasn't until this comprehensive health vision that the issue of getting off pork became important. Tobacco in any form is a slow poison. Tea and coffee, other similar to tobacco, are slow poison. And Rich cake pie, so forth should I be eaten. So I say that quickly because that's the hardest one for. So, but that's the principle that was that was given here. And then she talked about, of course, continue this hydrotherapy concept of pure water should be used freely, maintaining health and curing illnesses. Obeying the laws of health will prevent many illnesses. And God is too often blamed for death caused by violation of nature's law. That was a hard statement. That you're blaming God for things that are really in your own hands to control. Was an interesting principle there. Many die of diseases caused wholly by eating flesh food. The other one that is important, this is the last one in this context, is that overwork breaks down both mind and body. Routine daily rest is necessary. And the conversation about Sabbath rest was so important. Caring for health, she said, it's a spiritual matter. The 1863 was the first time that Ellen White was tying health principles to spirituality. She brought that together in 1863 health principle. Now so it now arrests the thinking of the religious leaders in the church, because Ellen White is saying, not only are we talking about your health, but taking care of your health is now a spiritual matter. It has something to do with your relationship with God. That came out of this comprehensive health vision. And the healthy mind and body directly affects one's morals and one's ability to discern truth. That principle came into existence, and all God's promises are given on condition of obedience. This was in the comprehensive health vision of 1863. That's why this is so important. In 1863, there was something else that took place. In the same year, 1863, here's where I want to go with this. So while we focus on Ellen White Comprehensive Health Vision, the same year, President Abraham Lincoln's Emancipation Proclamation liberated millions of slaves from the diabolical and inhumane bondage of slavery. This act was the culmination of centuries of human resistance, revolts, and emancipation movements. The African diaspora, the transatlantic slave trade and beyond, covers all the Caribbean islands, of course. It's a global movement. It has a large impact in South America, especially, and other countries. It didn't come really to the United States until 1619. So there's over 200 years of enslavement taking place globally before it came to this country. That is important to know, thank you, because we have a very strong, diverse, and international church. And often when we talk about this experience, we lose 200 years of enslavement in talking to all of our communities. Does that make sense? So I do let's talk about it from a 1690. I like to talk about it from the African diaspora and the global impact of slavery. But the culminating issue of January 1, 1863 is quite significant. So for me, there are three providential events that happened in 1863 that connects to my Adventism. It connects to my passion and mission of how we communicate our health message. So the Emancipation Proclamation was January of that year. We also see in the same year the General Conference was organized. And in that same year was this comprehensive health vision that came from Ellen White. For me, these are all three connected and interconnected, and it is a part of presentation. But rarely do I hear when anyone talks about Adventist history in health in 1863, rarely do I hear the connection of the other dynamic event that took place in the same year. It's just a fact that exists. It's in the same year, 1863, and this is my setup still, that we got this picture of Private Gordon. Private Gordon escaped from slavery just before the emancipation and wanted to work for the Union Army to eradicate slavery. But what was required of all Union officers was that before they were allowed to work, they had to go and get a physical exam by a physician. It was during this physical exam when he had to take his shirt off, whatever he was wearing, that the keloids on his back were discovered. And the physician that was attended to him asked permission for him to take this picture to send around the world to show, get this, just one picture of the physical trauma of slavery. That was the intent. Not the emotional, not the social, not the family, but can this picture at least send an alarming message to the impact that slave had on you and had on so many others? Stay with me here on this, because this becomes critically important. We discover from this book, Sick from Freedom by Jim Dawes, a book that I've read and just helped transform and just added some things to my own research. We must remember that the Emancipation Proclamation happened in the middle of the Civil War. Civil War was going on. Lives were being lost. Thousands of young men in this country were dying. Let's not forget that. Families are being wrecked, divided, in the North and in the South. Regardless of the Confederate position or the Union position, the point that I want you to hold on to is that individuals were dying in droves during the Civil War. Very difficult time. Emancipation also happened in the winter. It was January 1, 1863. And although we're talking about mostly southern states, it still was cold. It was the winter months where emancipation took place. It was in the same season also. You have now the migration of some 4 to 5 million free people who are set free with no place to go in the middle of a civil war, no resources, but you're free. Please get the context. I'm building something here. It was in unhygienic conditions, unsanitary conditions. And those of you who study Civil War illnesses and sicknesses, the diseases from smallpox to a number of things, the illnesses, the suffering, and the deaths were incredible, taking place not just because of the war, but individuals who were set free were dying. And in fact, you read some accounts, there were even Union troops that didn't want these freed people to come near them because they thought that they had contagious diseases that they didn't want to impact the Union troops. There were a number of things, without medical treatments taking place and so forth. That was there also. There was no shelter. There was no food. And I would be remiss if I didn't mention, because of this, the Freedmen's Bureau. Remember, it had a long name. Refugees and Abandoned Land became the Freedmen's Bureau. Was established by the government in 1865 to start to address some of the atrocities of the Civil War and what was taken in liberation and freedom because of abandoned lands. The economic conditions of the South was radically turned over because the labor force was now set free. You couldn't force folk to work anymore. So there were abandonment of plantations and other things taking place. A number of dynamics were taking place in this same time period. I mentioned the horrors of this time period only to celebrate, of course, the 13-year time period of Reconstruction, which was probably one of the most positive times for liberated people, but only lasted for 13 years because Jim Crow came up, after that. But here's my main point here. I wanted to build that with this critical question. Why didn't Ellen White's health visions include the challenges newly emancipated people faced between 1863 and 1865? If you think about 4 million people in the United States who are in the most dire health conditions, when you read from 1863 to 1865, there is nothing in her comments that speak to the plight of these people. Have you ever thought about that? Now, when I raised that with some of my colleagues in the E.G. White estate, I was like, no, I'm not raising this for you to get defensive. I'm raising to make sure that if I miss something, please bring it to my attention. Because all that I've read of Ellen White's writing during this time period on health and so forth, in this time period when all of the Emancipation Proclamation is taking place, It's not there. In fact, if you go to the E.G. White Estate, the beautiful E.G. White Estates, and you look at the time period there, I think they mentioned Civil War, but I pointed out, they said, you don't mention, there's nothing here that mentions emancipation on your whole time wall. It's not there. And, they agreed. I was just simply trying to be factual. That's why I was doing this. So why was it? Why was there silence? Especially, get this, when we talk to all of our communities about Adventist health, we use this time period. We talk about, oh, you want to know Adventist health? You don't want to know our origin? We immediately go to 1863 to talk to even communities of color in America about the significance of Ellen White's health vision in 1863. That's all. The question is, why didn't Ellen White talk about it here? Well, I got an answer from Ellen White. Amen. Because when Ellen White looked at the plight of what was taking place of black people, Ellen White was bold enough in 1861 to talk about the sin of slavery. Don't miss this. That God was going to punish the North and the South. One for having it, the other one for allowing it. So God told the church, God told anyone that would listen, God is going to deal with you because of the sins of slavery. And that was a bold thing for her to say in that time period, especially the church leadership that she was talking to. Here's my point to you. So I'm going to go on because I have a biblical foundation for this, and I'm going to land. I know I got to land soon, but this is critically important. When I talk to my communities, which I got 173 churches to talk to, I talk to my communities about not allowing other people to write your story for you. Our story, our health message does not start in 1863. Our health message from Ellen White starts in 1861. And if I'm going to connect with my communities, I have to bring in the issue of slavery or I become automatically irrelevant. It's not about making anybody uncomfortable. It is about taking the historical facts there to write a narrative so that I can contextualize and reach underserved communities, especially black communities. Don't miss that. That's a critically important concept to where I'm going. Now, where does this come from? You remember, everything for me must be anchored in Scripture or why you're doing it. You remember when the children of Israel in Exodus, the 15th chapter, were finally delivered? Notice, so they came out, they've come through the plagues, they came through the Red Sea experience, they watched Pharaoh's army was drowned in the sea, and now they're safely on the other side, and there they are for 3 days, and God sent them out long enough for them to get thirsty so they can turn back to God again out of all the trauma they are going through. And you know the story that this tree turns water sweet, and then God, after God satisfies their thirst and gives them what they need, then he says to them, if you adhere and follow me, then all the diseases I brought upon the Egyptians, none of them will come upon you. But this is the point that I don't want you to miss. Then God said, let me reintroduce myself to you again. I know you know that I am the creator. I know you understand that I am a provider. You obviously know that I am a deliverer. Of course you know that I will fight your battles for you. But God now introduces himself for the first time to newly liberated Israelites, his people. I want you also to know that I am a healer. I am the Lord that will heal you. But please don't miss the progression here. It wasn't until God's people were delivered out of bondage did God introduce himself to them as a deliverer. Now that I got your attention, I also am your healer. Because while you're in bondage, talking about healing doesn't matter, because I'm still in bondage. You can heal all you want to, but I'm still broken. I'm still down and out. Another place, you remember when Moses went to tell the children of Israel, and he went to say to them, look, God is going to deliver you. The Bible says in Exodus 6 that they didn't believe him because they were so discouraged. They had been in bondage so long that even when good news came their way, they would not believe it. You see, the biblical principle is this. Our health message is irrelevant to talk to people who are still in bondage, who are still down and out, who are still discouraged, who have been oppressed, without resources. The message is not relevant. I find that in Scripture. It's only when God brought them out then the message of being a healer makes sense. Jesus picks up on this same notion. You remember when he was stood up and went to Nazareth, and he stood up in his church to preach, and the Spirit of the Lord was upon me. He started by saying to preach the gospel to the poor. First thing we started with was poverty in America. To preach the gospel to the poor, to heal the brokenhearted, to proclaim liberty to the captive, to recover sight to the blind, to set at liberty those who are oppressed, to proclaim the acceptable year of the Lord. Jesus is saying, this is, not only did I do it for the Exodus, but this is my mission for humanity. This is a holistic gospel message to do this. So it's out of this concept that God began to trouble me in the midnight hours. You ever had those experiences where God wakes you up at 2 a.m. and it won't let you go back to sleep until you put something down that's coming from him? I started to praying and looking at this, and I realized that we need a new word, Lord. We need a new acronym. What is it? You see, I'm a person who has used successfully New Start. And I've been blessed by Creation Health. I believe in those programs. They have served me well, and they have served my middle class and upper class Black Adventists well. They're great tools for us, and they work well for us. Can I say something? I don't want to offend anybody because I believe in studying these, but I have to tell you this. I'm one of those who fully celebrated and embraced and asked everybody to read. You remember when Dan Buettner first came out with the Blue Zones? You remember how successful that was? I don't know about you, but that was a great breakthrough for me, especially for my skeptical people who are always claiming that you're saying these things about Adventists, but where is it proven and so forth. They didn't want to hear about the Adventist studies, but the Blue Zone changed the narrative. Now look and see. And then Netflix series did another series on the Blue Zones again. But let me tell you initially why I could not use the Blue Zones as an example. Loma Linda matters to me. My wife has 2 degrees. She has an RN degree and a PhD from Loma Linda. We spent many years there, traveling there a lot, so it means a lot to me. But the reason why I can't use Loma Linda University, not Loma Linda, not just university, as the Blue Zone example in Baltimore, in the hood, and the 22 cities in the Allegheny East Conference that high percentage of impoverished people, with all the social ills in inner city, that the social economic status of Loma Linda is not the same to these cities. There are food deserts there. There's a high crime area there. There are no safe places to walk in these communities. Their primary care physician in these underserved communities is the emergency room, because if you don't have insurance, that's the way you still have to be served. They don't have primary care physicians. They don't have safe places to exist and so forth. So I can't take what is there and just apply it to underserved communities the same way. It's good for Loma Linda, but it's not good for West Baltimore taking place there. So you understand that. So it's out of this. concept. So, Lord, we need something contextual. What speaks to us, speak to our needs. So the motif had to be found in the Bible and culminate with the second coming of Jesus. That anything we do, for me, if we're going to blend the health message and the end time gospel together, it must have that biblical approach. You can talk about issues now, but it must always end in glory. As an Adventist, I believe that. So this word will address past, present, and the future of wellness. And that word that we're talking about is deliverance. Deliverance rooted in wellness. Deliverance rooted in wellness. Deliverance is also an acronym. It has 11 letters. I know we like to build on Ellen White's, like 8 is the only number because the 8 principles of health. So everyone has worked with the number 8, but we need more letters because our challenges are greater. And we have other issues to look at. And you will see in deliverance, what I'm about to spell out to you, is that it's more than just something that serves the church. It is individual-based, it is church-based, and is also a community activist response. Because if health doesn't impact community, it's only something for a club. And our message requires that our holistic health goes to all people groups in all the world. So what is deliverance? Deliverance is an acronym with these 11, and I'm going to go through them one by one. This is several things. This is a process that's in developing. It's a process of becoming a podcast. It is becoming an online course, online program. I'm going that way because an online course you can tweak and develop and get it right before you try to produce something that's permanent. Because I don't want it to be a program. You heard that earlier, because programs may have a short lifespan. I want this to have longevity beyond me. So the issue is deliverance, and here's what it stands for. Deliverance is the bridge that connects the Seventh-day Adventist health message to underserved communities. That's critically important because, again, I still believe that God gave our message, our health message for all people groups, and we have to make that relevant. So what is it? Data is, when we talk about individual, do you know your own medical history? When I'm talking to underserved community, underserved people, it's amazing to me, and you know as clinicians, the issue of how intimidated people are about even the basic process of going to a primary health physician. Do you know your medical history, your family medical history? Are you updated on your vaccines? Do you have an annual physical exam? And data is a personal assessment regarding holistic health. We need data, not just for the scientific reasons we talked about, but I talk in this curriculum about individuals. There's data you need to navigate deliverance. That's where it starts. And it moves on from there to the environment. We look at the E. The environment impacts home, school, work, activities, water contaminations, lead pipes and paint, landfills, and et cetera. Flint, Michigan was in the news for a number of years. And it was one of the most horrific stories that lived on because we had churches, we had Adventists in Flint, Michigan also that were impacted by the water quality that was there. But so the issue of knowing your environment is critically important. Moving on, then also lifestyle. I think about lifestyle, I think about choices, I think about a person's style. Everybody has a style. You know that, right? They have what I call a style and a swag. Some people have more swag than others, but you don't have any swag. But okay, they have the swag, music, entertainment. But when we talk about deliverance, we got to talk about how it impacts lifestyle and lifestyle choices. And inspiration. There is no such thing of deliverance without God. That is always critical for us. It's always about God. It's a gift from God, the internal and external motivation, the guiding light that directs the wellness journey. That comes from God and who God is. Moving along, this is a heavy one here. Deliverance, the V stands for voting. Do you know, we were talking earlier about these community health needs assessment. But what is interesting is that political scientists and health determinants, individuals deal with determinants of health, can prove that a person's health is often determined by the zip code they live in. So where you find a lot of underserved people, just look at the zip code. So imagine if we can empower people to address negative wellness determined by zip code, hold decision makers accountable. You see, I want people to vote now. While you are pushing politically, voting has everything to do with your health. If you want to address food deserts, you want to address violence, you want to address poor schools, you want to address parks and issues in your neighborhood, then vote. Vote out the wrong people and vote in the right people. But see, underserved communities know that they have large percentage of individuals who just are so distraught that they don't vote. I'm trying to make voting a health issue if we're serious about deliverance. And so you see what's there. It moves on to emotions. There's such a big issue about emotions and mental health that are taking place today. If you're going to be delivered, you got to deal with your emotions. You got to deal with re-education. The miseducation out there is just phenomenal. The amount of ignorance that they're spread on, or the issue of what folk, grandma and great-grandma taught them about health that they carry to them even today. The re-education has to take place, and not, I'm always amazed at individuals who go online to, what's the sites they go to, some MD doctor online to discover their diagnosis and what's wrong with them. They have not spent one day in medical school, but they now know what is happening with their own bodies and so forth. There needs to be a re-education that takes place for our people moving forward. We also got to look at it, we're talking about deliverance, because each one of these, we mentioned, is a class, is a program, it's a curriculum that deal with addictions. And that's something that in our communities we don't do enough of. Or if we deal with addictions, it's always somebody else's problem, or it's just the big 2 or 3, substance abuse, pornography, and that's it. We don't talk about food addictions, sugar addictions. We don't talk about shopping addictions. Help me, somebody. Some folks don't talk about shoe addictions. I'm not looking, I'm looking around. Shoe addictions. There are a number of addictions that impact anything that is pleasurable can become an addiction. We live in a sinful world. So if we're talking about deliverance, we must address the issue of addictions and nutrition. Those basic principles are always there, nutrition. The third point, expressed through culturally unique foods. What I find interesting here, and especially in underserved communities, is that there has to be a heightened cultural sensitivity about what food mean to them, their identity, their purpose, and their culture. So sometimes I hear Adventists talking pejoratively about, I went to this neighborhood and used to see the stuff that they eat. And we laugh about it without understanding the cultural connection. It may not be in your plate, but it matters to them. And if we're interested in delivering and transforming people, that we have to connect with them culturally and know why and what, and take the time to understand before we can move them away. There are some folk, there are people who eat strange stuff. I mean, people who eat flying bats. Well, that's the last thing I want to see on my vegan plate is a flying bat. Eating or to be eaten. But do we take time to connect culturally with individuals when we talk about nutrition if we're serious about deliverance in underserved communities? And rooted in community. We talked about the issue of belong, and I heard in one presentation how COVID really has exposed the aloneness that exists, the loneliness that exists in our culture, and knowing that God created us for community, and we got to help to maintain that and pull people often out of isolation, because where you find the absence of community, you find embedded habits of the lack of deliverance that takes place. You find more people back in bondage who are not in a sense of community, and so we have to help them. Community does that for them. And rooted in exercise. Exercise for me is critically important. My third bullet, I call it worship in motion. That's what exercise is. My movement is worship in motion. It's 2 things. It's worship in motion and it's medicine. That's what it is. And so we got to encourage movement all over and continually take place. So you see in the deliverance, the 11 letters, you also find the basic principles that exist from Ellen White's health message. But it's gone beyond that, because deliverance is for a person, it's for a church, and it's for a community. You want to transform a community? Then take a deliverance plan to them. Because while I'm looking at you, I'm looking at these fundamental principles. I need to make sure that you engage in your community, that we're transforming the community, that we're looking at those social determinants of health, those health inequalities. And through deliverance, through the principles in deliverance, we're able to address all those things to move us toward wholeness moving forward. I'm almost done. This statement I found real fascinating from Ellen White. Our first duty, one which we owe to God, to ourselves, and to our fellow men, is to obey the laws of God, which include the laws of health. If we are sick, we impose a weary tax upon our friends and unfit ourselves for discharging our duty to our families and to our neighbors. And when premature death is the result of our violation of nature's law, we bring sorrow and suffering to others. We deprive our neighbors of the help we ought to render them in living. We rob our families of the comfort and the help we might render to them, and we rob God of the service he claims of us to advance his glory. Then are we not, in the worst sense, transgressors of God's law? You know, I tell individuals this who are in a deliverance plan or who are in a wellness plan, and those who are not, I tell them that not caring about your holistic health is the ultimate act of self-centeredness. Because you are then assuming, because your lack or your inability to care about your health, you're assuming that somebody else is going to take care of you. What an ultimate act of self-centeredness to do nothing about our bodies. Remember Joe Cool? This was the Camel cigarettes advertisement in the late 1980s and 1990s that when the cigarette company decided, let's make Joe Cool not look like a camel on four legs. Let's make him look like a man. Joe Cool, camel. What is interesting is how he looks. You see, they knew that they were targeting black and brown communities. I was in Harlem when I left seminary and saw this up. And what caught my attention is that there was a pastor, a Baptist pastor by the name of Calvin Butts from the Abyssinian Baptist Church in Harlem. He saw that at all the subways, all the billboards, all the bus stops, Joe Cool was up, advertising, getting young black men addicted to smoking and not allowed to, of course, break free from smoking. So he did something. He used to walk around Harlem with cans of spray paint to deface the advertisement that was up there. And of course, he was arrested, and it made media. Because wherever he went, if he got out of jail, he would get his spray paint and go around and spray Joe Cool to deface it. The vandalism would take place. And he was constantly getting arrested, but he was constantly making his point. They're targeting our young men. They're trying to get the young men in Harlem to get addicted to cigarettes. I'm trying to get them off. I'm trying to clean them up. And here Joe Cool comes, here the cigarette company come, doing just the opposite. Well, during the same time period, I was at an Adventist church in Harlem. Cheryl knows. Few thousand members taking place. And I began to think, wait a minute. Here you have a pastor, a faith-based leader, trying to address a critical issue in the inner city. And there's an Adventist church right here, a very large Adventist church, 2,000-3,000 people. At that time period, we had the 5-day plan to quit smoking. Of course, I know at Loma Linda, I think 2014, that the Breathe Free 2 was developed by a couple at Loma Linda. But what is interesting is that although our church had this program, we never connected with our community in Harlem to do anything about it. The Adventists didn't. We had the program. We have another faith-based individual trying to address the program here, the issues here, So while he was targeting the marketing and trying to address what was taking place in the black communities, the Adventists could have come along and said, while you're doing that, we want to partner with you because we have something to help you to stop smoking. Showing how, again, church and hospital and our systems can work together and should work together. My brethren, the Lord calls us for unity, for oneness. We are to be one in the faith. I want to tell you that when the gospel ministers and the medical missionaries' work are not united, there is placed upon our churches the worst evil that can be placed there. Our medical missionaries ought to be interested in the work of our conferences, and our conference workers ought to be interested in the work of our medical missionaries. He's calling us to come together, to do this work absolutely together. My passion, what God has given me, to help to move the needle for underserved communities is this process, this program, this curriculum, this initiative called Deliverance. That's what God has called me to do. God has taken a pastor and pushed him out there with something holistic based upon what God has been sharing with me. That is a part of the holistic message of the Adventist Church. And for me, deliverance is that answer. So I thank you for allowing me, Grace, thank you for allowing me to share this presentation with you. This is all the contact that I have. You see, I put 2 cell phones there. One is a conference, the second one is my personal. That's probably the better one to reach me. So I just want to thank you. I don't know if there are any questions, but this is what deliverance means for me, and I pray for our church moving forward. Okay.
Actually, I do have a.
Oh.
If churches want to get a copy or want to set up some sort of a program in their community, what should their process be?
For deliverance, besides contacting me?
Or just contacting you?
Contact me, because again, this is Grace, as we know. Let me just be transparent. So I've been in my position for less than 2 years. And I spent the first year in a lot of prayer and study and asking God where we're going. And there are 3 initiatives that have come out of it. This is one of them. There are 2 others. So I share this with the executive committee first to let them know this is what God has been downloading in me. This is where I see we ought to go. There are others, and there's a clinical one also for healthcare professionals. But I told them that it's going to take time for this to roll out completely as a finished product, as an online product, which is being built now. But Grace, what has happened is that the interest for the presentation has grown so much that it's pushing me out to do things. And I promised the Lord, I said, Lord, if this is something that you want me to share, I'll share it. That was a dangerous prayer. So what I've been doing is really trying to encourage people to start looking holistically at their health. And I'm really trying to, for especially communities, underserved communities, to help us to rethink this great health message that God has given to us, to start it from a different perspective. But all communities need Ellen White's health message. It's how we get them there. Is really the process. So I like to help people to grasp that, and churches to do that. And then while I'm there, I always like to work with health ministries team and pastors about their own health. So the best way is to contact me.
Thank you so much. All right, let's give Dr. Medley a hand.